What I want to talk about now is obviously some of our clinical, some of our results, both financial, but I also want to focus on the fact that this is just not a cost savings model, okay? Jason talked about our 4 goals: improving the healthcare status of our community, patient satisfaction, decreasing cost, provider satisfaction. If we don't hit those and what we're doing, we're going to close up shop, okay? It doesn't make sense for us just to focus on one of those. If we don't make it better, we're going away, because that is going against who we truly believe we are and why we're here to do what we're doing. So what about some results? We have seen in our first year, taking care of those initial 15,000, we've grown to 50,000, but this is data on those 15,000. We've seen a decrease of 12.2% in cost, okay? That translates into about $5 million, and that's what we've seen in our first year. And a huge, huge thanks to all those health partners and Wendy and her whole team for really going out and being our special sauce to really help make this work. What you see on this slide is you've got total cost of care. This is some of this great data that we're able to get out of Crimson, and the circle is basically where we started. So you can see the trend down for total cost of care. This is basically how much is spent not only by the person that's paying the bills from a payer or an employer standpoint, but also this includes the patient part. So when we talk about decreased total cost of care, we do mean that it got cheaper for not only the employer, for St. Thomas Health in this situation, but also more importantly to us, for our associates, my fellow people I work with. So healthcare became cheaper for us. So then the question is, well, did they get better care? And our answer is obviously yes, because of how we're doing it. Another way of looking at it is looking at emergency department costs. Those also, once again, the circle went down over the year. So that is not only the cost in the emergency department, this is really driven by decreasing avoidable visits to the ED. And the only way to decrease avoidable to the ED is how? Getting them the appropriate care at the appropriate place, delivered by the appropriate person at the appropriate time. Okay, that's sort of my mantra when we talk about healthcare. How do we make sure that they get the appropriate care by the appropriate person at the appropriate place at the appropriate time? So this is an example that is beginning to work when we look at emergency department costs. Readmission rates. Okay, so then the question is, what about hospital rates? We talked a little bit about the husband and wife we saw earlier in readmissions. We've also seen a marked decrease in our readmission rates. And there's not a slide up here, but you see the same graph, just like I talked about preventive ED visits, we're also beginning to see preventive admissions. In other words, by delivering care at the appropriate place, at the appropriate time, by the appropriate providers, you begin to see these really have a great impact.